Good morning, viewer. Welcome to our Glory Globe TV. Here's the alarming news. Yes, huge irregularities in the matter of medicines in India. How our greedy drug dealers hit the best-selling drug in Europe without an operation to improve health. Dr. PM Swami, Indian endocrinologist today, he is considered to be the best specialist for diabetes, told above alarming speeches. Dr. PM Sami completely confirms that in most cases type 2 diabetes can be treated with modern knowledge. Topics covered: what is most important in the treatment of diabetes? 2. What do 95% of patients fail to cope with their condition? 3. When is there a chance of complete cure of diabetes? And 4. What are the modern methods of fighting this disease? Yes, metformin is not what you need. Today, most of the diabetes treatments are based on metformin-based drugs. However, this is a delusion of illiterate patients and doctors. It is not a matter of treatment. If you visit your doctors with type 2 diabetes and he adds these drugs to his treatment, stay away from such a doctor. Medicines in which the main substance is metformin, that is Bagmot, Vero, metformin, glycomate, glycon, gliminfor, glyformin, glucofa, glucophagus, glucofag, long, dinormate, diaformin, langerin, metadone, metformin, metafogama, metformin and novoformin. All these medicines increases the level of insulin in the blood too much. With this amount of insulin, the blood becomes very thick. Having a large amount of insulin in the body causes great damage to it. It almost destroys the liver, kidneys and other excretory organs. Insulin is like stomach acid in consistency and action. Imagine what would happen if stomach acid flooded your internal organs. They will burn with acid. The increased level of insulin destroys the cells, causing them to divide abnormally, and this is oncology. Because of this, according to statistics, 28% of diabetic patients develop cancer. In addition, large amounts of insulin cause the rapid accumulation of cholesterol in the blood vessels. As insulin slows the flow of thickened blood, because of which the blood vessels get clogged with cholesterol, due to which the blood pressure rises. 98% of diabetic patients suffer from hypertension and many other problems of the cardiovascular system arise in them. List of bad consequences of metformin treatment. Yes, one, stomach problem, most often diarrhea, upset stomach, sour blanching, stomach ulcer. 2. High blood pressure. High blood pressure, especially in the evening, headache, ringing in the ears, fear away. Cirrhosis of the liver. The liver develops into connective tissues and stops clearing the blood, and toxins build up throughout the body. Excretion of large amounts of salts and sugars leads to formation of stones in the kidney. Yes, cancer-related disease and blindness. The onset of disease, of course, depends on the amount of drugs and the duration of taking them, as well as on the individual characteristics of the individual. However, it is not possible to get rid of them completely. If metformin kills like this, then why use it? Unfortunately, today most doctors are not concerned about the health of patient. I had say no one cares. They just do their job and get paid for it. They do not care whether there is any improvement in your health or not. That is why, without much thought, they prescribe the same medicines which are advised to them by the officials or ministries, and these drugs are made on the basis of metformin because there is a huge profit from their sale. And yes, they do have an effect, even if only for a short time. There is no cure for indifference. Patients are not aware of the consequences of continuous use of this medicine and do not feel it necessary to inform the doctor. Treatment diabetes with strong chemicals, it is a crime. But type 2 diabetes is curable. The main thing is just to choose the right treatment. Dr. Prem Sami told, I often comes across patients who have been on metformin treatment for many years. These are sick people who grow old before their age. As in the past, patients are often diagnosed with type 2 diabetes by chance during tests, and by that time the patient was feeling fine and he never imagined that his blood sugar level would have increased. After this, he is advised to take metformin with increased doses. Its consumption reduces the level of sugar in the blood, but with time, the patient's condition worsens. The patient starts complaining of constant fatigue, obesity, increased blood pressure, headache, etc. Swelling starts in the feet and also on the face in the morning. A bell rings in the hour, the fingers start going numb, and there is a feeling of coldness on their ends. Eyesight become weak, memory deteriorates. Doctors say that it is due to diabetes, but actually it is because of insulin and more precisely metformin, which increases the production of hormones to abnormal levels. Even if you don't feel like you don't need diabetes treatment, if you have to decide whether to treat diabetes with metformin or not to treat it at all, you will definitely choose the first option. If left untreated, type 2 diabetes will give you more rest earlier but with other symptoms. Imagine cherries or raspberry is wrapped in sugar. The same happens with all vessels in diabetes. The walls of the vessels become completely saturated with sugar and become brittle, due to which the ability of the vessels to contract and expand is over. First, the fine vessels are destroyed, then the medium sized, and then the large one. These vessels nourish the internal organs. Long lasting disease being due to a decrease in blood supply. How diabetes destroy from inside? Loss of sight. Diabetes means blindness, and blindness forever. It is impossible to correct vision loss caused by diabetes. Even with laser treatment, as many hemorrhages cause the retina to decay. Kidney failure. The sugar clogs the ureters, which makes the environment of the kidneys sweet. Sugar acts as a preservative and preserves the kidneys, and they slowly start dying and continuing kidney failure starts happening. This is just the beginning. The kidneys can be completely destroyed. Joints begin to tighten. Synovial fluid gives mobility to the joints. When blood vessels are no longer able to nourish the joints, synovial fluid stops forming. Joints begin to dry out and wear out. Humans have so much pain that it's difficult to wear. Painkillers also do not help. The joints are completely closed and the person's ability to move on his own is lost. The nervous system is no different. Like many other organs, nerves also suffer from excess sugar. Over time, patients with diabetes develop psychosis. The patients become emotionally unbalanced. He often starts having problems of depression. He does not feel good. He just wants to lie down, sleep, and die. The skin starts to rot. First, it becomes very dry. There are scratches, then eczema, and then ulcers. Muscles and bones begin to rot along with the skin, and unpleasant smell starts coming. It all ends with gangrene. However, diabetes is a very dangerous disease, but probably the most dangerous. I feel sorry for those who suffer from diabetes. I try to help them, but it all depends on them. If there is no metformin, how is it possible to treat diabetes? For example, let's talk about a common pensioner citizen who starts complaining of diabetes with age. Now the level of sugar in his blood has started increasing continuously. Let's assume that he takes metformin and is not feeling well. What can he do to cure diabetes? Will he be able to fix himself? I want to remind you again that type 2 diabetes is a complex, dangerous and systemic disease. It is not a cold or diarrhea. This is a very bad disease. The disease spreads throughout the body, and therefore the treatment should also be at the level of the whole body. Simply rising insulin levels is not enough and is harmful. The treatment of diabetes should be comprehensive and only with drugs that not only lower the sugar level but also protect the whole body. If there is a specific way to help people manage their diabetes on their own, I would recommend capsules like Herbal Diabetes Capsule. It was prepared in 2015 at the Indian Institute of Endocrinology. Like metformin, it is not composed of chemical substances but rather a natural anti-diabetic complex which includes more than 60 different active components. The composition of this capsule contains all the most important vitamins, macro and micro elements required for type 2 diabetes. Herbal diabetes capsules contain 28 herbal extracts collected from different parts of the world. The goodness and the goodness of herbal diabetes capsule is that they do not cause any harm to the body. Rather, they provide strength to the body of the diabetic patient. But most importantly, they have a positive effect to the disease from all sides. Beyond the report, Glory Gov TV.